gripped this country and the world right now, COVID-19 and the coronavirus. With us today are many of our medical professionals from UPMC, AHN, and Pitt Med, as well as our health department personnel, and I'll be introducing them in just a minute. But let me just say I have been so gratified that over the last few days, this community has reached out to us, our office, in specific, our corporate community, our business community, our universities, our friends in labor, the foundation community, nonprofits, all wanting to help, all wanting to support during this time. And that's what we're so fortunate that we have here in Pittsburgh and the Pittsburgh region, people that work together to do what we need to do to get through this situation. Let me introduce some of the folks who are standing behind me, and you're going to hear a number of these speakers. A number of those are going to be speaking and taking your questions as we move forward. From the Health Department, we have the Chair, Dr. Lee Harrison, along with Dr. Deborah Bogan, the new Director of the Health Department, along with Ron Sugar, the Acting Director, Dr. Kristen Mertz, and Dr. Luann Brink, the epidemiologist from the Health Department, who've been putting out a lot of the information that's been going out over the last few days. Our speakers are going to be Dr. Harrison along with Dr. Bogan, Dr. Brian Parker from AHN, Dr. Dawn Yealy from UPMC and the University of Pittsburgh Med. Also in attendance that we have here with us today, Claire Zangrilli, Chief Nurse Executive from AHN, as well as Dr. Cesar DeLeo from Highmark. We also have with us from the county, we have the County Manager, Willie McCain, Deputy Manager Steve Pilarski. We have Matt Brown, who's a place we're in, the Chief Operations, Emergency Services, as well as my Chief of Staff, Jennifer Liptak. As I said, this has been a situation that I don't know if any of us have ever been in before. As we go through this, a lot of the information that's coming out, we want to make sure that we are hearing from our medical professionals. And we are so fortunate that in Pittsburgh, we have some of the best and the brightest medical folks, people who have dedicated their lives to science, dedicated their lives to medicine, and dedicated their lives to public health. And they're here to give us a lot of information. I also want to thank our friends in government at all levels. Our friends at the federal level, Congressman Doyle and Congressman Lamb and Senator Casey have all reached out to be helpful. Governor Wolf and his team at the state level, along with Department of Health, State Department of Health, our state senators and representatives who've been briefed on what's going on, as well as our local elected officials. We're very fortunate that we have that level of cooperation that occurs across jurisdictions, across party lines, business, labor, et cetera, public, private sector working together. One thing I do want to emphasize right now is that there have been no cases as of yet, no positive tests that have occurred here in Allegheny County. But we know because of what's happening in other parts of the state and some of our neighboring communities, neighboring states, that may not be the case for very long. But we want to be prepared, and that's where we want to be to give the public the best information that they can prepare for any eventuality that may occur from the organizations as well as individuals, family members, and try to get good information out there. So at this point, let me turn it over to Dr. Lee Harrison and Dr. Deborah Bogan to come up and talk about some of the work that's going on within the Allegheny County Health Department. Dr. Harrison, Dr. Bogan.
Thank you very much, Rich. First, I'd like to start by reiterating some basic facts about COVID-19. People at highest risk of contracting this infection are those who have traveled to places where transmission of the virus is ongoing, or have had close contact with persons with COVID-19. Persons who are over 60 years old and those who are with underlying medical conditions are at increased risk of severe outcomes. Earlier this week, we encouraged individuals in the most vulnerable groups to follow these proactive measures that will help stop the virus from spreading within the community, avoid large events and mass gatherings, as well as other settings where you could have close contact, defined as within 6 feet, with a large group of people. Continue proactive hygiene measures such as washing your hands frequently, covering coughs and sneezes with a tissue or elbow, and frequently cleaning high-touch surfaces, and stay home if you are sick, and call your primary care physician to discuss next steps. To reiterate what Mr. Fitzgerald just said, at this time there are no confirmed cases of COVID-19 in Allegheny County. As of just a little while ago, the number of presumptive cases in Pennsylvania is 22, most of them in the eastern part of the state. We do believe that the virus will eventually be seen here too, but we are preparing and prepared for it. There's been a great deal of conversation about testing for COVID-19. First, we want to make sure that we're using the right terminology. Locally, Allegheny Health Department coordinates the collection of samples for those individuals who meet the set criteria for high-risk patients. Once those samples are collected, the specimen is sent to the state lab, and results are being received in less than 24 hours. Less urgent cases are being sent to commercial labs for testing as additional labs are being brought online. I'll leave it to AHN and UPMC to share where they are at this time with testing within their facilities. Testing is not available on demand, much like how other types of medical tests are handled. If a person has symptoms that could be consistent with COVID-19, they should contact their healthcare provider for consultation. If they do not have a healthcare provider, they can contact the health department for consultation. Individuals who believe they need immediate medical attention should contact 911 rather than driving themselves to a hospital. Emergency services have implemented measures to identify whether 911 callers seeking help are at increased risk of having infection with COVID-19. Responders have been provided with enhanced personal protection equipment should they encounter somebody who we think could have the virus. Additionally, teams can be deployed to assess those individuals without further exposing the public to the virus. Residents can do their part by getting a flu vaccine and taking everyday preventive actions to help stop the spread of germs, including staying home if sick, covering coughs with sneezes with a tissue or using your elbow or sleeve, washing your hands often with soap and water for at least 20 seconds, or if available, using hand sanitizer with at least 60% alcohol, and routinely cleaning frequently touched surfaces and objects. These measures can go a long way to prevent the spread of illness and respond to the outbreak. For all businesses and organizations, it's recommending that CDC's guidance be followed, encourage sick employees to stay home or separating sick employees, emphasize cough and sneeze etiquette and hand hygiene, performing routine cleaning of frequently touched surfaces, and providing disposable wipes for those surfaces to be used by employees. We are not recommending at this time that large events be canceled or changed, or that businesses and organizations make changes to their operations. Like we are doing, we suggest that everyone look at or prepare their continuity of operations plan to make sure that their decisions are based on those plans and what's best for their organization. The department is providing ongoing information on the coronavirus through its website. So it's www.alleghenycounty.us/coronavirus, social media pages, Facebook and Twitter, and with Allegheny Alerts, which you can find on the Allegheny County website. So with that, I will turn it over to Dr. Bogan.
Good afternoon. I'm just going to make just a few reiterations because Dr. Harrison covered really the most important information. In general, this virus, for most people, is a mild illness. The people at risk are those that are elderly and have underlying immunocompromise. So, again, that's the good news, that most people with this illness have mild symptoms. But if you are sick, even with mild symptoms, please stay home. Keep your children home if they are sick as well. And use all the things that Dr. Harrison talked about: hand washing, covering your sneezes, wipe off surfaces, and contact the health department if you have particular questions at that, and your primary care provider for questions as well.
Now let me introduce, and again, we are so thankful in this region that we've got such great medical institutions that have reached out and been willing to help and willing to come in this time of need. The first speaker I'm going to come up and say a few words is Dr. Brian Parker. He's the Chief Quality and Learning Officer at Allegheny Health Network. Dr. Parker.
Thanks on behalf of myself and AHN and Highmark Health to the County Executive for inviting us here today. For the last 2 months, AHN has been preparing for the coronavirus illness to arrive here in Western Pennsylvania. As always, our primary concern is the safety of our patients, their families, our caregivers, and the many communities that we serve. As confirmed cases of the disease spread throughout Pennsylvania, we are especially concerned for the elderly, those with existing respiratory conditions and heart conditions, diabetes, and those that are immunocompromised. To protect those populations and everyone else, we've established a number of safeguards to mitigate the spread. We are limiting the number of visitors and folks who can visit our patients in our hospitals. We've put in place new patient screening criteria at all of our facilities. We've made modifications to our electronic health record for those screening procedures. And we're working with nursing facilities, rehab facilities, and our partners in the community to make sure they're following those protocols as well. We're also working with our home care teams, pre-hospital partners, and EMS services. Lastly, along with our colleagues at UPMC and across the medical profession, we're doing the best to educate the public about the symptoms, safety tips, and the best practices. To prepare our hospitals for coronavirus and COVID-19 and the possibility of a significant outbreak or surge, we are following the recommendations of the CDC and working closely with the county and state health departments. We're developing inventories of critical equipment and all of the things that we would need to deal with increased volumes of patients. We are conducting regular stress tests and tabletop exercises at our hospitals, sharing our learnings, and making sure that we are prepared for pandemic-level infectious patients in our facilities. We're also working closely with our supply chain partners to make sure we have the necessary and requisite equipment to take care of them across the continuum if this does present itself. We're also working closely with our lab vendors and the folks for testing to be able to do this in-house as quickly as we possibly can. And we're working closely with Highmark Health, Highmark Inc., across our enterprise to make sure both our patients and members are informed and educated about this disease. As I've said, we've been working on this for many months, but that said, and as Dr. Harrison pointed out, we need an engaged community and an engaged public to follow the recommendations of both the Departments of Health and the CDC to ensure that we have the best possibility of combating this coming to our community. Thank you very much.
Thank you, Dr. Parker. And the last speaker, and then we'll open it up for questions, is Dr. Dawn Yealy. Dr. Yealy is the Chair of Emergency Medicine of UPNC and the University of Pittsburgh. Dr. Yealy.
Thank you very much, Executive. It's a privilege to be here today. And you've heard a lot about coronavirus and some of the preparations that have happened at the governmental level and with some of the healthcare systems. You might wonder, after hearing all this, why are we here today? We're here because you're afraid. And there's nothing wrong with that. That's healthy. It is natural to be afraid, and I'm not here to tell you not to be afraid. What I'm here to do is share with you the UPMC and the University of Pittsburgh role in helping to mitigate that fear, making that fear into a tool that helps you manage this particular threat. And we can manage it. It does not have to become incapacitating for all. First and foremost, we're prepared to take care of patients who develop the coronavirus infection. We have a large cadre of hospital beds of all types throughout the county that can serve any type of need. We have outpatient facilities that can accommodate whatever type of need you have. Call first and engage us, and we'll help walk you through this scary event. Next, because we work at an academic world-class medical center, I have access to partners that can actually develop approaches that don't exist in other places. We can help identify the virus more frequently. UPMC is working on its own in-house test, not just the tests that are brought in by other agencies, to help improve the testing abilities so we can describe what's happening here in Western Pennsylvania sooner and better. We have experts that are working on ways that once you become ill, that we deliver the best treatment that's available. Not only standard supportive care, but virus-directed therapies, and we're engaged with those opportunities right now. Finally, we want to be part of the solution, using that intellectual firepower and the tremendous clinical opportunities to try to put this virus away definitively. That's going to require new medications, new vaccinations, and perhaps other therapies. They won't come quickly, but UPMC and University of Pittsburgh have been ahead of the curve on this. We've been working on agents like this for years, and I think we will have an opportunity to help end this much more quickly than in other settings. I'm happy to answer any other questions.
And with that, let us open up to questions, and we'll direct them to the appropriate person.
Dave Templeton, Pittsburgh Post-Gazette. There's ongoing concern about how many test kits are available, how much testing is being done. We have people telling us that they have been sick, they've contacted physicians who told them not to even come in for testing. Can anyone explain exactly what's going on with testing?
Who wants to jump up? Dr. Mertz, do you want to, our epidemiologist from the health department? You can identify yourself. So.
Hi, Kristen Mertz, medical epidemiologist at the Allegheny County Health Department. So currently, the state health department laboratory is doing the test for COVID-19. CDC is still doing the test, and LabCorp and Quest are now doing testing for COVID-19. So there is laboratory capacity now, and some of that is quite recent. As you know, the state health department started testing last week, and the commercial labs this week. There's a slight bottleneck now in specimen collection because the specimens have to be taken with providers using certain protective equipment, and up until very recently, it was recommended that everyone have a fitted N95 mask, face shield, gloves, and gown, which meant that it was difficult to collect the specimens unless you were in an emergency room. That requirement has been loosened a little bit by the CDC, so if providers don't have fitted N95s, they could use surgical masks and face shield. But still, we're sort of limited right now in the amount of people who can do specimen collection. So starting next week, we're expecting there to be more specimen collection sites, and we'll be able to test more people. So earlier, before we had this laboratory capacity, the criteria for testing were fairly strict, but now they're much more loose, so there'll be much more widespread testing as of this week.
David Kaplan with Channel 4. Just to expound on that a little bit, I mean, we have the head of the response from the CDC saying this morning we're not doing well with testing. I mean, is that the case in Allegheny County? I know you talked about this bottleneck, but we too have gotten calls with people who have called and said that they either haven't gotten a call back or have found the response from the health department to be disappointing, to put it fairly. So, I mean, is there an issue in Allegheny County right now? Do you wish you had more? I mean, how can you sort of explain the state of play as it relates to the amount of tests, where they're coming from, how quickly they're getting done?
Dr. Mertz will.
There's a lot in there, I'm sorry.
Yeah. So, yeah, I mean, I do wish we had more ability to collect specimens, and like I said, several agencies and institutions are working on that, and so that should get better next week. We're not at the point now that we're testing anybody with a fever and a cough, so we're testing people who have some kind of epidemiological risk plus symptoms, so either travel to an international destination or within the U.S. where there's known ongoing transmission. So we are limited right now in that capacity. In the future, if we start getting cases and it becomes widespread in Allegheny County, I'm sure we'll start testing people who haven't traveled. To get a commercial test, however, you do not need approval by the health department. All you need is a physician's prescription. So if your physician thinks you're at risk of COVID-19, you get a prescription, and the physician can set up a place for you to get the specimen collection, then you can get tested without health department involvement.
And just for clarification, what is the exact reason why people who have a cough or display some of those lesser symptoms that you just described, what is the exact reason that they are not being tested right now? Is it because there aren't enough, or is it because there's just no reason if they don't there's just no reason for them to?
Well, at present, we don't think there is a reason. I mean, we don't have known transmission in the county. So, of course, we'd like to do some testing of those people just to make sure there's no transmission in the county. But we don't want to fill up the ERs. Like I said, at this week, the ERs are really the places that are doing the specimen collection with people at very low risk of disease. So there are other lots of other patients coming to the ERs for other reasons, and we don't want to use up all the resources on low-risk people.
If I could jump in here a little bit, in the emergency departments, we're happy to see you. That's not a concern at all. But we want to make it a value event for you and to make sure that we can actually serve you as best as possible. There are many times, even before this current coronavirus episode, that people may have wondered about a particular illness or infection and say, I want to be tested for it, but required a conversation with their physician, and then a decision often isn't to test necessarily. I think probably everybody in the room has had that particular experience. The fear that I talk about may drive people to think that they actually need the test. That does not mean after a little bit of screening together with your physician that doing the test is the most appropriate next step. And so that's what I would remind you about it. Having the thought about it, this is where we can manage our concerns about it. It's healthy to have the concern, but it's not necessarily healthy to think that every individual thought has to be acted upon.
What's the timetable on UPMC's test? Sorry, just since you all are developing one.
Yeah, very quick, but I can't give you a very specific timeline right now. The truth is that we had been working on detections of this and similar viruses prior to the spread into the United States, and I would expect that in a very short period of time we'll have an independent test. The goal is to use that together with what's available from the government and what's available from the private sources that you've heard about to make our ability to diagnose individuals and to describe what's happening in Western Pennsylvania better.
Cool.
Paul, Pittsburgh Business Times. Mayor Petito said last night there weren't enough hospital beds for a pandemic, and said that they were identifying, along with healthcare officials, alternative locations in case of they're needed with personnel and equipment. Can you tell me a little bit more about that and how the health systems are preparing for a surge if one happens?
So I'd say a couple of things. One is, as a network, we would look at being able to move patients around across facilities, not look at just a single facility as what are we going to do in one hospital, but leverage the assets, including also looking at things like other hardened assets and buildings that we may have that we own, a place like potentially, floors that maybe haven't been used recently, nursing units that we can, as we talked about, cohorting patients, doing those sorts of things. So instead of having them spread throughout a facility, you create an area where you've got that population now being cared for by a specific group of caregivers. And also looking to say, is there another place where we can put them that isn't inside a healthcare facility necessarily because they need to be isolated, but their level of care isn't necessarily at the level of the hospital. And that would be true for both patients and for caregivers if we needed to do that in a pandemic situation.
Dr. Parker, do you know how much more capacity there would be in those solutions for both you and UPMC and UPMC? Dr. Yealy, you have a lot of facilities as well. And also, right now, actually, how many ICU units there are, or ICU beds there are, in fact, in the Pittsburgh area, or even if you want the 13 county region?
Yeah, so I would have to defer for the ICU bed count across the region, but I would say, looking at this as a community response, is I think we're going to also have to all work together as systems and as hospitals to also leverage our resources together. Because if we start to see things like what happened on the West Coast, where healthcare workers are taken out of play for 2 weeks at a time because of exposures and things like that, we're not going to be able to do what we have to do from a pandemic standpoint if a surge actually comes here. We've got to think about how we work together and through the health department and through the county executive's office.
Yep. I'm sorry, go ahead.
Let me answer a little bit on the UPMC side. Of course, we'd work together with our partners, not only from AHN, but other institutions in the region. And as you've noted, we have a very large system. Right now, in Allegheny County, there's a little over 3,000 UPMC beds. That could easily be increased by another 30 to 40% by already exercises that have been completed. We began preparing in the first week of January, fearing that this might actually be necessary. That's the easy expansion. I suspect we could add even more capacity on top of that of total beds. I think more important than the total bed need is what kind of bed, and secondly, as you heard, what about the other assets, particularly the people? I think in any type of broadening exposure of an infection, our healthcare workforce is going to be the most important. And we have a tendency to focus maybe on the physicians or the nurses, but think of all the other people who are involved with care. I think that's where a lot of the planning is going to have to be, making sure that each person is doing what is needed and doing it optimally, but not actually wasting activities, and making sure that we're deploying every singular resource as best we can.
Joe.
Maybe for Dr. Harrison, but whoever wants to answer. Governor Wolf today urged statewide no large gatherings of 250 people or more. He urged, not ordered, but he urged people not go to shopping malls and movies. And then he took stronger measures in Montgomery County, where he actually ordered some of those places to be closed. I just wonder what the difference is for us, and is it because there have been no confirmed cases here? What's the difference?
Well, I'll let Dr. Harrison come up. I've also already noted that a number of organizations have canceled events in the near future. Empty Bowls, for example, is one of the big events we have that this Sunday has been canceled. We were going to host a G7 in a couple of weeks. That has been canceled. And a number of other events that I know different organizations and folks have canceled in an abundance of caution, I guess, along with what Governor Wolf indicated today. Montgomery County has a little different situation because they have identified a number of cases. We have not at this point. But as Dr. Harrison outlined early on, there are some places where certain folks who are in a certain classification, the elderly and people who have immune issues, immunization issues, to avoid certain large crowd events. But I don't know, Dr. Harrison, if you wanted to add to that.
Yeah, Rick, I was basically going to make those points. So I think most people, we're in a bit of an unknown era right now. This is a new virus. And so I think a lot of people are erring on the side of caution. So each organization makes its own decisions to a certain extent, but I think the key things are that if you are sick, you should definitely not go into a crowded area. And if you are very vulnerable, as we said, the case fatality rate goes up after the age of 60 in patients with underlying medical conditions. So those very vulnerable patients, those are the ones who are vulnerable to severe outcomes. They should not go into large crowded places if they don't have to.
Dave Templeton again from the Post-Gazette. Does this all dramatically change if you have just one case? Does all of this go away and you're having another news conference to tell us that things are being canceled? Is it a matter of one case?
I'll let Dr. Mertz, I'll let you.
Yeah. No, the usual recommendations are for taking community mitigation measures, canceling large events, et cetera, if you have community transmission. I think a lot of places are acting early because they think they're going to have community transmission the way they do on the West Coast and in certain places. But one case might not necessarily change what we say. I mean, it depends on the circumstances, too. If it's a case that hasn't been anywhere, hasn't been in contact with anyone, that raises your suspicion for, maybe there's other cases like that. But if it's somebody who comes back from a known country that has coronavirus, hasn't been outdoors since they came back, and test positive, I don't think there's any reason to change anything drastically in that situation. So it all depends on the situation around the case or the first few cases.
Dr. Gilly, Dr. Parker, and actually Dr. Brooks, too, Carl Brockman, Business Times. Are you seeing any cases, like are you seeing an increase like you would for the flu season, at the peak of the flu season? Are you seeing anything in your emergency rooms that are not, that are unexplained or anything, or is the emergency rooms heavier traffic now than say a week ago?
Emergency departments have a seasonal variation in patient presentation, and this time of the year is common an elevated amount of ED visits, either directly to or indirectly related to infections, and particularly influenza. And this season is about in the middle of the pack for that. So just as this particular coronavirus infection landed here in the U.S., we were in the plateau phase of that influenza breakout. Now, influenza and coronavirus, even though we've not seen that specific infection here, at least not the COVID-19, are indistinguishable in the beginning. So have I seen people in whom some way you might have had the thought of COVID-19? Yes, but none of them have actually had it here yet. And that's actually the challenge of providing care at this time of the year. I don't know if there'll be any seasonal change with COVID-19. There is often with influenza and other viral illnesses. We simply just don't know much about that right now. I would not describe the current emergency department volumes, at least from the UPMC side, as excessively high. One of the things that we're here about is to talk about managing your fear. And what you can do for us is to help people understand that you don't probably need an ED visit if you're not experiencing symptoms at all, particularly if they're not severe.
Yeah, I would agree with those remarks in terms of the volume. And let's not forget that right now the way you get to the ED for testing and that evaluation is through a conversation with the county health department or via the clinical suspicion, where then we're calling ahead and letting them know that patient's coming in to be tested. So the number of people that are presenting with a suspicion of just saying, I think I have coronavirus, is very low. So from a volume standpoint, all those individuals are being very intentionally directed to that location as they're funneled in through the system using the screening criteria that exist up front, either through a phone call or a visit to a PCP, a primary care physician's office.
David Kaplan with Channel 4 again. Two questions. First, can we say how many people have been tested in Allegheny County? And secondly, what are the conversations like with some of these counties in the eastern part of the state, just in terms of how they're monitoring, the steps they're taking to try and mitigate it coming to Allegheny County? I mean, what are you learning from other counties? What can you learn from other counties about what they're doing to try and flatten the curve, so to speak?
Well, first of all, not all counties have health departments. In fact, very few in the Commonwealth have health departments, just a handful or one. So a lot of that will be communicated through the State Department of Health. But I'm going to ask Dr. Mertz about that question. I think some of that information comes from the state.
Yeah, I mean, I think what we can say about what we've learned from other counties and other countries is that you need to have different approaches simultaneously going on. So the concept of containment is really identifying cases, identifying their contacts, their close contacts, and quarantining their close contacts. So that in itself is very helpful in reducing spread. And then on top of that, adding community mitigation measures of social distancing, enhanced cleaning, personal protective measures, all those things. So it's really a multifaceted approach that's been shown to help reduce the burden of disease in communities.
And my first question about the number of people tested in Allegheny County?
Yeah, we are not releasing that, and it is changing every day, obviously, but that's not something that we're saying. Yeah.
May I ask why?
Well, frankly, the state just released the numbers for the state, and I don't think that any other counties have done it, so we're sort of following suit.
I think that they're controlling this, so we're not permitted to give that information out. Yes?
We've seen Maryland and Ohio take some drastic measures with their schools. Does Allegheny County have any indication as to maybe what you guys can personally do, or is it sort of something you'll follow along with state guidelines? Is that something you've talked about with the schools here in Allegheny County, potentially taking some sort of measures?
Dr. Mertz?
Yes, we are in touch with all the schools, the school nurses, the superintendents, et cetera, and that closing of schools is really a case-by-case decision. It is the school district's prerogative right now to be able to make their own decisions, and I think it depends on the situation. So if they were to have a student who tested positive and who had been in the school, then we would work with them to figure out the best approach for that school. So far, obviously, we haven't had that situation. But we are encouraging them to develop plans for if they have staff shortages, if adults start getting sick, or The people have to stay home with their kids, to think about online learning if they were to close, to think about their school meal programs, because if they do close, there's some kids that are still going to need food. But that, again, would be, us talking to the school district on a case-by-case basis.
Okay. Well, thank you. And again, we're very fortunate that we've got some medical experts, and living in Pittsburgh, having these, very few communities have what we have, so we're very fortunate. I want to thank all of our facilities today, AHN, UPMC, PitMed, as well as the health department for work they do. What I would just encourage is stay tuned. This is obviously a changing situation as time goes on, but we really want to listen to our medical experts. The science really matters, and we want to make sure that we're listening to these folks who have dedicated their lives and their careers to public health and medicine, and that's the best thing we can do. Thank you.
Thank you.
Thank you.
Check 1, 2, 3, 4, 5, 6, 7, 8, 9. Yeah, Mike, and we certainly have a lot of questions specifically about the testing portion of this, and we sort of got a mixed bag answer. But the best we understand it is that there was a situation that when they were originally testing people, they were essentially required, the Centers for Disease Control required people to own certain levels of personal protective equipment. We're talking about the healthcare professionals that were sort of handling the specimens. So that required a lot of equipment, a lot of time, and in order for them to send them off to a state lab, which is actually in Export, Pennsylvania, as part of the state health department. So there was a time where healthcare professionals